In New Hampshire, working to stop the spread of tuberculosis, they are searching for anyone who may have come into contact with an adult who tested positive recently at a homeless shelter in Manchester. So here to answer questions tonight is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. If I hear tuberculosis and 2025, it does not compute.
Right.
But it does.
Yeah, it should, because it's the #1 leading infectious disease killer in the world, not in the United States.
Yeah. So the state believes that it is a threat, the public health threat level is low. Do you agree with that?
Absolutely.
Oh, good.
In New Hampshire, they probably have a dozen cases a year. And even in Massachusetts, we have under 200 cases a year, right, of active TB. What is tuberculosis? It's a bacteria. It's slow growing. It can cause a pulmonary infection. Yes, it's contagious, but it's not contagious like COVID or measles. You have to have extended contact with the person. And it causes a respiratory infection. It can cause a pneumonia. The good news about it is there's time between the time you're infected and you can actually do a blood test to see if you have what we call latent TB, which means it's kind of hanging out dormant. You can give medications to prevent active TB.
Oh, that's good. All right. Is it fair to say that infections are rare here in the United States?
I mean, I wouldn't call them rare.
Okay.
There's about 10,000 patients who develop TB in the United States each year.
What about the rest of the world, though?
Listen, it was hitting an all-time low in 2020, but over the past 4 years, we have seen a spike up, probably because there's more travel. You know, we're obviously coming out of our homes and things like that, and there's more congregant. But one thing to say, this New Hampshire case was in a homeless patient. Homeless patients do have increased risk of TB, you know, and it can be harder to track them.
There is a vaccine available, right? So do you think Americans should get it just in case?
The answer is no.
Okay.
Because the current vaccine is it's not a great vaccine, and we don't have enough cases of TB in the U.S. In other parts of the world where there's super high cases, yes, we give it, but there are TB vaccines that are being studied right now in early clinical trials.
Dr. T, great to see you.
Good to see you.